What is the SUDS scale in vivo exposure? Have you ever felt anxious about something, like riding a train? If so, you might be curious about how therapists measure that anxiety. One helpful tool they use is called the Subjective Units of Distress Scale. This scale, often shortened to SUDS, is a simple way for individuals to rate their anxiety levels. It ranges from 0 to 100, where 0 means no anxiety at all and 100 indicates extreme anxiety. In cognitive behavioral therapy, especially during in vivo exposure, the SUDS scale plays a key role. During therapy, clients confront situations that make them anxious in a safe and controlled way. For example, if someone has a fear of trains, they might gradually expose themselves to the idea of riding one. As they do this, they can use the SUDS scale to express how they feel. Let's break down the SUDS scale a bit more. A rating of 0 means you feel completely at ease. A score of 20 indicates low anxiety, while 35 shows moderate anxiety. If you rate your anxiety at 50, that means you are experiencing significant anxiety. A rating of 75 suggests severe anxiety, and a 100 means you are feeling extreme anxiety. When using the SUDS scale in vivo exposure, clients often start by creating an exposure hierarchy. This is a list of situations that cause anxiety, arranged from least to most distressing. For example, a person might start by just thinking about trains, then watching videos of trains, and finally, visiting a train station. They rate each situation using the SUDS scale, which helps both the client and therapist decide which situation to tackle first. During exposure sessions, clients continuously report their anxiety levels using the SUDS scale. This feedback allows therapists to adjust the exposure tasks based on how the client is responding. If a client feels overwhelmed, the therapist might suggest taking a step back or trying a less anxiety-provoking task. Clients are also given homework assignments to practice exposure between sessions. They can use the SUDS scale to track their anxiety levels during these tasks. This helps them see their progress over time and can lead to a decrease in distress. In summary, the SUDS scale is a vital tool in cognitive behavioral therapy. It helps clients understand and manage their anxiety, especially when facing fears like riding trains. By using this scale, therapists can tailor their approach to meet the unique needs of each client, making therapy more effective.